Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Good morning. Good morning. This is David Parra, and this is AARP, Arizona Hispanic Connection, a platform that addresses very important issues in the field of health, finances, even history, and, of course, education. Today, another important show. It's called Latinos, What the Health. I was a little hesitant to use that phrase, but I thought it was very appropriate. Latinos, what the health? This is it's a play of words, of course, and it's supposed to wake us up in a sense. I think there's a big issue with obesity and chronic conditions. This is the third show that we have on this matter of nutrition and diet and exercise. So we're going to keep having these kinds of shows because we feel it's very important. So again, Latinos, what the health? The idea again is to address the issue of obesity in terms of the family, but with some emphasis on children. And we have 5 guests today. So this is what I would like to propose that we do in the first segment. I'm going to ask each one of you to introduce yourselves, give us your name, where you work, and then take a minute to 3. It's up to you. Tell us what is your realization. I know that it's critical. I know that these numbers, the statistics, the data that what we're learning about the issue of obesity, it's very, very serious. I am going to be talking a little bit later on about a concept that I learned in YouTube. Actually, I'll throw it in right now. But in Mexico, I believe it's in Mexico City, there is a concept, just like the Alcoholic Anonymous, like AA, they invented this term, Dragones Anónimos. And at first I thought it was like a joke, but it's not a joke. It's actually a concept that is going on in Mexico to kind of invite people to come in, those that have really serious issues with eating and controlling their diets and their weights, etc., their health in one word. And they invented this concept of Dragones Anónimos. And people come in and they just, apparently they follow the same concepts of the Alcoholic Anonymous. But that kind of paints a picture, of the desperate situation that we are in. And I'm so glad that we were able to get all of you to come as our guests. You're all professionals and in this field, and I am so happy. So let me start, and it doesn't have to be in any order. I'll leave it up to you, and if you don't volunteer, then I'll call on you. But give us your name, your title, and then what is your realization, your understanding of how serious this is. And then we're going to start talking about some tips and concepts about educating ourselves on how to eat better and be healthier.
My name is Elvia Lish. Mm-hmm. I am a registered dietitian, nutritionist, and certified diabetes educator for, this is a long thing, Family Wellness Program at the Society of St. Vincent de Paul.
Right.
We have a nonprofit medical clinic here in Phoenix. I work with the Latino population. I think we all know that it's a very serious issue that our communities face. But I think what I have come to realize through my work with the clinic and our programs that we offer is that really we just need to be able to provide that support for the community, provide them the resources and programs that help them overcome the barriers to change. Mm-hmm. And I think someone will touch on it, but behavior is a big thing that is not as easy as people think. It's not, I'm going to make a change and it's going to happen. You really need a lot of support to identify those issues and then also be able to maintain the changes that you implement.
Mm-hmm. And how getting into this field has shaped the way you personally take care of yourself in this realm?
I think it has shaped me more in the way that it's made me relate more to the people that I serve because I know how hard it is. I don't think that anyone can say, oh, well, I eat 100% healthy every day.
Right.
So I can relate a lot to them. I think it made me realize how much of a need there was, and it just made me more passionate about what I do.
Do you feel that you implement some of the concepts that you've learned in your profession on a kind of almost like natural way, or you kind of have to push yourself to continue to adhere to those concepts?
I think in some ways, yes. And I think in some ways you kind of have to overcome your own personal barriers to continue to, like, for example, I will admit exercise is not one of my favorite things.
Okay.
But that is one thing that I work towards every week, and I constantly have to combat those barriers.
My name is Xochitl Wilson. I am a supervisor at a local district. It's definitely very urgent. I see many kids deciding not to eat at all, whether it's breakfast or whether it's lunch. Sometimes there's this, like, it's a bad thing if you're eating school food. So
you're saying that there's that kind of a concept that
Yes.
schools do not feed you healthy food?
No, that kids, it's like if I eat a school meal,
Okay.
that makes them feel like, oh, you're eating school meal. Right. There's a stigma. Thank you. Yes,
stigma.
that's the word I
Okay.
was looking for.
Okay.
There's a stigma. So some kids decide, you know what, it's more important for me to be outside talking with my friends
Okay.
than coming in through the lunch line.
You see that? Do you see then in schools that a lot of kids do not go in and have lunch, or they
Correct.
just basically go out and play or talk with their friends?
Yes. I mean, unless there's something on the menu that they really like, they'll go through. If their friends do it, they're going to do it. If their friends don't do it, they're not going to do it. And so you kind of do see that. And for us, it is somewhat easy to track because we know how many kids are coming through the line. So
Right.
it obviously that also guides us into, you know, what menu items are liked or not. But there are some kids, you know, which, you know, I've had the privilege of working with certain groups or, you know, of kids at school. And I asked that question. They're like, oh, we just would rather be outside, or I'm not used to eating breakfast, so I don't need it all. And it's like, how do you function
Right.
the entire day without eating breakfast or lunch?
And again, the same question, in your experience in being aware of this issues of healthy eating and stuff, how do you implement in your personal life? Is it a struggle? Is it natural? You have to work hard at it?
I think it's always something that you have to work on. It's very easy to say, you know what, I'm going to have this that may not be healthy compared to something else that may take you maybe a couple more minutes to, you know, fix, like an oatmeal or something like that.
Right.
So it's definitely something that you constantly have to work on. You know, sometimes you're so tired you don't have time or you don't want to go and work out, but you have to keep in mind, it's like, if this is what I'm preaching, then I have to model that behavior. So it's, you know, it's important, but it's not easy.
Yeah, I'm sure that all of you have seen data, and data is super important. I spent a few minutes earlier this morning just going through the CDC is the website, right, which stands for Center for Disease Control. This is a government website. There's a ton of data there, unbelievable, and it's pretty scary. I understand the African American group is still beating us on that bad metric, if you will.
Yes, unfortunately, yes,
Okay.
but we're not too far behind.
So it's the African Americans. I believe their numbers are higher than Latinos. Then comes Latinos, and I think then the white Americans,
Yes.
and then you have the Asian Americans. They are very, very low. And their percentage of obesity seems to be very, very low in Asian Americans. Yeah.
My name is Monica Guerrero, and I'm a registered dietitian, and I currently work at Mountain Park Health Center located in Maryvale, which is in the West Phoenix area. I also kind of can vouch for what Xochitl said about children not wanting to eat their meals. So I do nutrition services and consultations for medical nutrition therapy among the pediatric population, which is children and adults. But in the pediatric population, I obtain a 24-hour diet recall, as we call them. So I try to get what I eat in a day from children. And oftentimes on those school days, they might eat the cereal, or they'll say that they have some kind of pan dulce, which is like a sweet bread,
Right.
if they're at home, and they don't want to eat the lunch. They just don't want to eat the lunch. And I think it's very cool to eat school lunch, but for some reason, those kids think that it's not cool. But and then they start to suffer in their academic performance. You do need that steady energy to be able to think and process.
Now, again, the same question, how much do you practice in your daily life? Is it a natural thing? How hard is it?
It was not always a natural thing. So I'm first generation, American, I guess, here. But my parents, we kind of had mixed, kind of a mixed bag between indulging. There's a lot of foods to indulge on here. Frankly, It's easier to eat something decadent than something healthy. But, occasionally they would try to ground us back and get us to eat fruits and vegetables every day. So I was very fortunate in that aspect. But by no means were we not, eating Starbucks and or having chocolates and everything. And, that's kind of how I grew up. But as I left high school, I did try to make that concerted effort to eat healthier, which eventually led me to wanting to become a dietitian, because even if I do have the title of a registered dietitian, but in my heart, I am a dietitian. No one can take that away from me, because it's just, it matters so much to me. And this is such a passionate subject. And I do see that it's a terribly, terribly urgent need now to get people excited about wanting to eat healthy.
Perfect. Before we come to you, I would like to come back to you, Xochitl, because can you help us understand what has happened lately in the school systems? Has there been a change, efforts, changing menus, anything that you can share with us on that regard?
Oh my, it's a kind of a complex structure, because there's guidelines that come from way from the top, which is the USDA, which is the United States Department of Agriculture. They set forth the guidelines to each state, and then each state decides how they're going to implement it, or from where. So like here in Arizona, our information is delegated from the Department of Education. So the Department of Education has a department that is called the Health and Nutrition Services. They have specialists that disseminate that information to the school districts.
So is it in the realm of categories of food, and then within each category you have different choices? So
the guideline is, and these change depending on what those needs are that come from the top. So the CDC does play a role in what the USDA ends up
suggesting, implementing.
Yes, and implementing. So these things can change every 5 years or every 10 years.
Okay.
So yes, there has been a change. So now school districts, and again, this goes back to if the school district or the schools or a daycare participates in the National School Lunch Program. If they do not participate, then there is no guideline to follow.
Wow.
But if the schools do participate in this, then yes, you have to have, whole wheat items. If you're going to offer breads, they all have to, start with the first ingredient being a whole wheat, of very low sodium items. And yes, per grade, so like K through 8 has a set amount of calories that they need to consume per day, per week. And then if it's a school, that was K5, sorry, or if it's a school that's K through 8, then they have a different guidelines as well.
Yeah, that is very helpful, because then, so there has been changes, there will continue to be changes, and then you share with us the sources of those changes.
Yes.
Thank you very much. We have to go on break. You're listening to AARP, Arizona Hispanic Connection. We'll be right back.
Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you. Thank you for staying with us. This is AARP, Arizona Hispanic Connection. I am so happy that we are able to have this show and bring in excellent guests to share information with our community on issues that are so critical, like education, health, nutrition, finances. And of course, from time to time, we also bring historians to tell us about the history of Latinos in this country. We've been doing that since May. All our shows are archived on Facebook and YouTube and podcasts and Stitcher. So feel free to look for AARP, Arizona Hispanic Connection, and see if you want to go back to any of our past shows that interest you. Let's come back to today's subject. Latinos, what the health? Got to be careful, huh? What the health? And again, this is a play of words. We use it purposely to kind of, raise awareness of an important, and I would even say urgent, critical issue that is what we are eating. And, you know, there is a saying that you are what you eat. There's all kinds of slogans out there. So we will continue the conversation with the first aspect of give us your name, your title, what you do, and then what is your general impression about this issue. We still have two more, and we left our PhDs to the end or last. And first, congratulations. You know, having a PhD, I assume, is not an easy thing, but welcome, thank you, and go ahead.
Hi, thanks for having me. I'm Sonia Vega Lopez. I'm an associate professor of nutrition here at ASU. And through my work, what I'm trying to do is work with the Hispanic population to promote healthy eating, physical activity, and find more effective ways of doing that. I have a couple comments to make to kind of follow up on a couple of the things that were said before. I had some experience working with adult Latinos who had diabetes, and through that work, I actually visited their homes, and the project that we were doing was trying to help them manage their diabetes better. So I could see firsthand all the complications that can come from having a diabetes diagnosis, and that can come from physical symptoms, problems with their eyes, with their kidneys, with their feet, neuropathies, that kind of thing, all the way through psychological problems from the stress of having diabetes and such a complex condition. Now, we're talking about childhood obesity, and one of the most concerning things about having so many kids, especially within the Latino population, that are becoming overweight and obese, is that we're seeing diagnosis of diabetes at much younger ages than we used to see them before. So we consider this a very serious issue because we don't want to see kids who start getting this diagnosis at 15 years of age, which means that they will start seeing all those complications that I used to see in 60-year-olds when they are 30 or 40-year-old. So it's a very serious problem. Now, my second comment is to bring a more optimistic side of things.
Okay.
Because I think that although we do have to make an effort to make changes in our behaviors, there are many things that we can do to make healthy food tasty and fun, and make it a family event even. Cook with your children and cook healthy meals, and it can be part of a lifestyle that, even though requires planning and is not going to be easy as opening a bag of pre-prepared meals, but it can bring the family together and bring all the nutrients and all the good food that you have to have.
Dr. Vega Lopez, would you mind sharing with us how you got started in this field? Was it early on? And then also in your experiences, how challenging it is to kind of practice what you preach, if you will?
Of course, yeah. Well, my bachelor's is in food chemistry. So I learned all about additives and colorings and artificial flavorings and stabilizers and preservatives and all the things that are added to processed foods to learn how to use them to make more processed foods. But then I started wondering, well, what's the effect of all those things in our health? And decided to shift towards looking at the effects of our food and our food system in health. So that got me more interested in nutrition. But at the same time, I love food and I like to cook. So I think that all got me interested in looking at healthier ways to prepare foods and make them so they have a positive effect in our health.
How challenging is it for you with your profession to still have time to cook?
The challenges have more to do with lack of time.
Right.
Because I work full time and I do have a commute like many of us do here in the area. And I have 2 kids, so we have to also bring them to school, pick them up from school. So in order to be able to prepare homemade meals every day, I have to plan ahead. And oftentimes I dedicate one day a week, usually Sunday, to cook larger portions of meals that we can eat throughout the week.
The same food or different foods?
We alternate, so I may make 3 main dishes that we alternate throughout the week.
I'm laughing because my daughter happens to have a degree in nutrition. She hasn't been able to pursue the registered dietitian degree, but she also does that because she works. So she says, "So you eat the same food like 3?" Oh, so yeah, 3 days easy, you know. And I have the luxury or privilege to, that my wife stays at home and she cooks. And that's why my kids like to come home because, they know they're going to find good food. But it is a very, very concrete challenge to cook and work and take care of children. It is just a fact of life, yeah.
And you can mix and match. You prepare 3 main dishes and perhaps, change the salad that you're serving with it and involve your kids in that. If your kids love cucumbers, well, it's their turn to chop a cucumber that we'll have with whatever meal you prepare.
Right. You have a comment before we come to Dr. Perla?
Yeah,
Vargas.
I just wanted to say I agree. I think that when people start doing those things, people start realizing how much time they save and the monotony of, I'm eating the 3 same meals a week becomes like, well, it's just so convenient. Like, I love it. And then the next week you make something completely different. So it's a challenge at first to get used to the idea, but I think it works. It works for us at home too.
And if I can add another quick tip, sometimes what I do is I will prepare a large portion of something and then freeze half of it so that I'll have it ready 2 weeks or 3 weeks later, and that helps you.
Yeah, we're going to get into this a little bit deeper, but we still have to allow Dr. Perla Vargas to. Now, you come from a different perspective at this.
Totally different.
Yeah,
and I'm more senior, so.
Which is much needed as well, and that's why, at the suggestion of la doctora Sonia, we really wanted to be here because you come from the behavior aspect of it.
Right.
Go ahead.
My name is Perla Vargas, and I'm an associate professor at Arizona State University, and I started interested in nutrition or diet more than nutrition initially, always, I guess. I started cooking for my family when I was 16 in Mexico City. So, and I was a full-time student, so it was a matter of learning to organize yourself, which is, I think, the hardest thing, and then learning to cook. That's the second. But I started as a behavioral therapist, and working with physicians on helping patients lose weight was sort of my first contact with that. Not necessarily from the diet perspective, from the behavioral perspective and the adherence perspective. It was like, how come I design all these things and people do not follow? So figuring out what to do to improve that was sort of what drove me in this area. And in the 60s and 70s, psychologists started working on what in those days they called the self-control of obesity, which is sort of the basis for some of the commercial programs like Weight Watchers. It's like if we have food available everywhere, we are more likely to eat like candy and easy to. So those cues trigger our behavior. So having easy to eat food at home is one of the things Weight Watchers recommend to remove. Throw
so
away
if
all
you
those
bring
things.
it home, somebody's going to eat it. basically.
Yes.
If you have it handy, it'll be consumed.
Particularly if you are distracted. What happens when we sit to watch a movie or something and there are candy, we may not even realize that we are finishing the whole thing until you finish it, then it's like, oh, it's gone.
So that seems to be a big key. So as long as you keep bringing food, that undesired food to the home, it's going to be consumed. Somebody's going to eat it.
Mm-hmm. Okay. Yes. So that was part of what interested me. Then I moved to a research center in nutrition, and I started reading, skipping the chemistry parts, but reading about nutrition and nutrition anthropology, which was really interesting, coming back to the issue of stigma, because eating is a social activity, and we have foods that have a status. For example, carne asada is a status food, a steak.
So what does that mean, that you are what?
Well, we want to eat the food that is sort of that the people that are cool, that are important, are eating. Okay. So if it's something expensive like meat, I remember when we moved to Sonora, everybody wanted carne asada. Okay. So that changes the perspective.
Wow.
There are studies, for example, during the war.
So again, status. You're linking status to eating.
Absolutely.
That's very interesting.
Yes, and that has to do with the stigma in the schools. Kids do not want the free lunch. They will better be catch dead than eating from a tray that shows they are eating free lunches. They prefer any other alternative than that, because there is a stigma associated with that, and it may not be obvious or too open, but it's there. Or they may be in the line for free lunch. So we need to work on these issues, trying to remove the stigma so they can feel more comfortable consuming that food.
Can I interrupt you?
Sure,
We're going to have to go on break, but we want to come back to you because I'm sure you have other concepts on the behavior arena that are so critical. We're going to go on our second break. You're listening to AARP, Arizona Hispanic Connection. We'll be right back.
Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you. Thank you for staying with us. This is AARP, Arizona Hispanic Connection. The subject today is Latinos, what the health? What the health? And we have special guests today, as we always do. Great, accomplished and successful Latinas here with us today, from registered dietitians to PhDs. And first of all, I congratulate you for your accomplishments. It's amazing to see successful Latinas, and thank you for everything that you are doing for our community. Let's come back to you, and then I believe, Sochi, you have a comment, and then we'll just kind of open it up to broader issues or more specific. But, okay, so you come from the perspective of behaviors, and we said that if you bring something to the house, somebody's going to eat it. You also said that food have some status linked to it.
Right.
I still remember some people, like in, say, in Mexico, if they usually eat beans and they're going to have visit, what is the first thing they do? Oh, my God, somebody's going to come in. So they go and get some meat. Because meat, there seems to be, like, if you serve meat, then you have money. You don't want to show that you are limited in income by not having meat. So anyway, would you mind just elaborating a few other concepts on the behavioral arena?
Just one more thing. I had beans for breakfast this morning.
I love beans, by the way.
And well, I was from the behavioral perspective, the importance of being able to follow the diet. After working in a research center on nutrition, I came for my PhD and work on cancer prevention, colon cancer prevention. So I was part of the adherence score for clinical trial. So you learn about the issues and the barriers, and sometimes it's the perception we can eat the same thing every day and doesn't feel like an imposition. But if you change the perspective, it may feel like it's boring. But it all depends on how we perceive that. So it's very important socially how we perceive food and how it's presented to us. So we cannot forget that eating is a social activity. And our food escape, they refer to now, has changed significantly. And we have added more sugar to make it more palatable and more attractive, colors. So I think in a way we have created some barriers, because now sometimes I remember going to the grocery store and having all these things in front of me, and you have to read the labels and decide which one is better. So the activity of selecting food and preparing food becomes more of a challenge. So it makes the picture more complex.
So let's see if I'm getting this right. So are you saying that there is almost like an industry that specializes in making sure that food looks attractive so that people consume
Absolutely. Sure.
Wow.
Sure.
And that those coloring and the things that you were mentioning, they're not necessarily healthy. In the study of those elements, what are we learning? The study of the additives and coloring and all that kind of good stuff.
Well, I'm not sure there is per se enough evidence to say whether those components are good or bad for you.
Okay.
But in general, when we're seeing foods that have all of those are more processed foods that in general will have less whole ingredients, more sugar,
Lots of
potentially
sugar?
more fat, more salt.
Salt, okay.
So it's all together, and all those additional components are to make them look good, taste good, stay longer in the shelves.
So are you saying that there's like a learning that goes on to see what people like the most, and maybe they will entice them with the way the food is prepared? In other words, they know what we like.
Of course.
Okay.
Yes. Well, we like sweets.
Right. We all like
savory
sugar and
stuff.
salt. Those are the two main things. And then fat.
And then the mouthfeel that comes
Right.
from a little bit.
What was that?
I said you can't forget that.
Right.
Gives it a lot of good flavors.
Yeah. So is that like natural for human beings to be attracted to salt, sugar, and fat?
Yeah, absolutely. I mean, earlier when food was scarce, when we found items that contained sodium, fat, or sugar, that told our brain that was a very dense form of energy, and that was an asset when food was scarce. But now you have to make an effort to avoid food sometimes, or eating, constantly. So we have to kind of be aware of that and make sure that we take control of those urges, because it's no longer appropriate if there's food everywhere. You have to make that choice, right, to make sure that you're kind of controlling what you're eating a little bit more, So it's okay to have sometimes, but if there's a dish of Hershey's chocolate at work, you might want to put a budget on how many of those you're going to have a week.
Now, this year, one of my resolutions was less sugar. And I was telling you off the air that I already managed in January and February to drink coffee with no sugar. I did not think I could do it, and I did it. And it's great, actually. I love it. I don't know why I didn't do it sooner. Actually, I had been thinking about it and working on it, but all of a sudden I just add a little bit of milk just because it's a little too bitter, too strong. And then also, like today, this morning, I had a little, and then the portions. I don't serve anything on bigger plates, just very small plates. And then I had, like today, my cereal with a banana, a piece of banana. And then I had an egg muffin, and then I had my coffee, and then I cut a little piece of bread, and then I told my wife, so if I had bread already on the muffin, and then I'm eating another bread on the sweet bread, so how can I replace that? And right away she says, some fruit. Thank you. So that I'm going to be more mindful of that. If I already had some bread, and even with the cereal somewhat, so I have to, but then obviously we still have more to learn. But I think I'm in the right track, and the one thing that I think I can say is I'm alert. I'm
Aware.
awake and aware, and I'm working on it. It is working. It feels great. You have lots more energy, and it just feels good. You wanted to say a little bit
I
more?
wanted to say one thing about sugar, because in the last probably 7-8 years, we have discovered that sugar plays a role in sort of addiction to food. It activates the same areas in the brain as some drugs. So it's important to be aware of that. And I don't think that the industry had bad intentions. The industry is an industry, and they do marketing. So they try to prepare whatever item will be better to sell, will be more acceptable. But I think we are getting aware of some of these practices that are really not healthy for us.
Right.
Something else I wanted to add to that. Some of the trends that we see with the types of foods that became so prevalent also came from recommendations that were given years ago. So in the 80s and 90s, we were studying heart disease and causes of heart disease, and there was a lot of focus on dietary fat and the role of fat. And fat became the bad guy. It was not until a little bit later that we started looking at food not only as ingredients or individual nutrients, but more as wholesome meals, that we realized that by recommending lower fat consumption, the consequence was to increase carbohydrate intake. And that in this country means very refined products, very refined carbohydrates, white bread, sweets, cookies, crackers, et cetera, that don't provide the fiber necessarily. So we ended up having a shift in what was consumed from eating a little bit more fat, which was what used to happen in the 50s and 60s, to a diet that was very, very low in fat, but very high in refined carbohydrates. And
So we
that
basically
turned
went from
out-
one extreme to the other.
That
in a
turned out
sense.
being worse, in my opinion, because we ended up eating a lot of plain starches and sugars that we now know are even worse than some types of fat that are very healthy and necessary for health.
Amazing. You wanted to, I hope you didn't forget the comment you were going to make earlier.
No, I didn't. So back to what Dr.
Vargas.
Vargas was saying, as far as the stigma that sometimes kids have with eating school meals, school lunches, there has been a change in added options for school districts that do participate with the National School Lunch Program to have these other opportunities to allow every student to eat for free so that there is no stigma. But even with that, I think the idea is still there, maybe with some students or some kids that, again, they still decide not to, go through it. But all these, changes and options are being created to eliminate some of those things. So things are being worked on for sure. I think it's a matter of people like us here to put this information out and inform people and make, parents aware that things are being worked. Yes.
So let me see. So are you saying, I think I'm understanding a little bit more of what you just said. Am I understanding correct that because getting free lunches at school, you had to qualify for it? That means you're of lower income.
Yes.
And there's that stigma, so kids prefer not to reveal, quote unquote,
Yes.
that they're of low income, so they prefer not to eat?
Yes.
Wow.
Yes.
Amazing.
And
you see that happening in a prevalent way, you think?
Well, many school districts still do that because, it depends on what part of the state you're in. Some communities are a little bit higher, so obviously the kids that come from, households that have a higher income, you won't be able to, meet the requirement to eat, for free. So, for communities that we clearly know are in, underserved or populations, those are the school districts that are gonna qualify for this
Right.
other option in
Right.
all the entire district eating for free.
Were you going to make a comment? I think. Go ahead.
I was just to emphasize Dr. Vega Lopez's point was I think a lot of dietitians nowadays, what we focus on is recommending balance and not choosing one over the other. It really makes a difference when every meal, breakfast, lunch, and dinner, or whatever meal pattern you decide to choose, you have a balance of each of the food groups. And that makes sure that you have all the vitamins and nutrients you need. I think even with diabetes management, with my patients, it makes a huge difference when they are focusing on moderation and not focusing on, I have to take this completely out. And another thing that I think has been important with, at least with my consultations with my patients, is talking about that relationship they have with food. Don't feel guilty for the decisions that you decide to make. It's okay to have certain foods sometimes, but you want to focus on having other foods more often than not that are more nutritious, that have more, are more dense in nutrients. So
Perfect. We are going to have to go on our last break, and then we'll continue with the conversation. You're listening to AARP, Arizona Hispanic Connection. We'll be right back.
Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you for staying with us. This is AARP, Arizona Hispanic Connection. The subject today is Latinos, what the health. I want to present three more concepts, and then just feel free to jump in. One concept is, what is a balanced approach in diet? We're kind of leaving exercise for some reason. It just happened, not on purpose. Exercise, we kind of didn't touch it, but we're focusing on diet. But what is a balanced approach that people need to have? Also, how linked is diet to chronic conditions? And then I think we need a breakthrough in this. And I know you are very optimistic. I tend to be more pessimistic in that I see a lot of like an urgency kind of thing. But you are the professional, so go ahead and help us understand what is a balanced approach, the correlation between diet and chronic conditions, and then how can we move on in a positive way?
So I think there's a very strong correlation between your dietary habits and chronic conditions. So what you're eating and how you're kind of treating that system, which is your body, is going to have a major impact on how well any existing or future conditions, how they'll progress or how they may improve. So, I think it's huge. You know, if we consider that there's certain medications that are prescribed in 2 milligram dosages, if we're eating a pound or 2 pounds of food every day, what does that have an impact? Right. How is it going to impact your body? As far as trying to come up with something more simplified to make a balanced eating recommendations, I think, I understand that meat, as we mentioned earlier, is a status thing, but I think in certain areas, the more vegetables that you see available during that, what you eat in a day, that's usually seen in more kind of affluent areas now, because, we now know that is integral to health, just making sure that you're integrating those. You don't have to exclusively eat vegetables. But if there's a way that you can cram a vegetable into your day or your meal, then that's a great recommendation. So currently we recommend that roughly 50% of your intake consists of fruits and vegetables. You would want to have it, that half, you would want more vegetables. Okay. So when you mentioned that you had an egg muffin, could you put a slice of tomato in there? Could you put some spinach in there? Can you do so things like that, or salsa, pico de gallo, Can you put onion? It can be nopales. There's a lot of things in Latino foods that are very rich in vegetables that can be added. Another thing is to roughly make half of any grains that you eat, which would include corn, pasta, oatmeal, cereals, breads, rice. If you can make half of those whole grain, at least half of those, then you're going to see a benefit in that too.
Perfect.
Yeah,
this is great.
I think it's also very important not to label it as this is good versus that is bad, because I think our brain automatically goes to, if once I see it, that's bad. It's the same thing with I'm on a diet. I don't think we should ever use the word diet. I'm just, you should label it as a healthy lifestyle. I think you should still be able to eat from all the 5 food groups, but it's just a matter of balance and being conscious about your portions without saying, oh, no, you shouldn't have any of that. Maybe there's going to be days when I'm going to have a little bit more of this and other days where I'm going to end up having more of the healthier stuff. It's just a matter of balance. And then, physical activity, I think we didn't really touch on it. But, of course, putting that in, with the kind of culture we live in and how busy we are, there's limited, time to do that. Maybe certain communities don't have the access to, parks, or they're not safe. Schools don't necessarily have physical activity, any PE offered anymore, or maybe it's just once a week.
Wow.
When, as before, it was every day. You were going to PE for an hour. So, all of those things. But I did want to point out just something Dr. Vega Lopez said earlier as far as like the additives and preservatives. During my professional life and doing consultations, because I did used to work for Mountain Park as well, and then I worked at the Head Start, but and now even at the school district, I've been seeing an increase of kids with food coloring allergies. And so that's increasing too. And again, it's all on what we're doing, what we're feeding ourselves, that's, increasing as well.
Right.
I'm a little bit more pessimistic, so maybe Sonia can have the very last word.
I know.
And I think something that we have learned is that all things are connected. There was the 60s and 70s where the focus was on one specific nutrient or other. And we have gone even broader than that. We now know, for example, that poor sleep tends to impact the production of the hormones that control our appetite. So it's important to have a good 8 hours of sleep, particularly for children. And we know, for example, so that stress impacts our sleep, and our sleep impacts the way we eat and so forth. Wow. So we realize that eating or the problem of obesity is all connected, that they're a chain of events, and we should pay attention to the whole picture, not just one nutrient at a time. Right. And the urgency is, if you go to the CDC webpage, you can see now they think that probably the life expectancy in the U.S. may be lower for the first time in several generations, and is probably linked to the number of people with obesity-related disorders. Right. So it's a serious health problem, increases the risk for diabetes, for high blood pressure, and other issues.
A couple more things I wanted to add. We were mentioning about the 5 food groups, and we already talked about fruits, vegetables, grains. We have talked a little bit about the protein group, mostly talking about meats, but there are other items that can be added to that group, which are beans and legumes, and also nuts. And those are really good sources of nutrients, both of them. Beans have a lot of fiber, have a lot of vitamins and minerals, and carbohydrates and protein as well. And nuts are very rich in very healthy types of fat. So those are very good to eat. And the 5th food group we haven't mentioned is dairy, which especially for children is very important because it provides calcium that they need to grow with healthy bones and strong bones. So not to forget the other 2 food groups that we had not mentioned as much.
Yeah. Thank you for mentioning those. I think it's important to make sure that people do realize that other foods also do contain protein. So one of the reasons why we recommend whole grains is because that can increase the protein content of those foods. But yeah, nuts are a great source of healthy fats as well. We discussed earlier how, in the 80s, particularly, fats were kind of downplayed. When I was learning about nutrition in 1993, we were then introduced to the concept of healthy fats at that time, and I think it's very important that we're getting on that track too. So all of those foods are great, dairy or dairy alternatives, just as long as it's a calcium-rich food, and that goes back to the vegetables. So a particularly dark green vegetables, broccoli also contain a lot of calcium as well.
We have just a couple more minutes, and I'm going to throw in a concept that could be controversial, but the lack of proper eating is linked to chronic conditions, and that puts a big financial strain on healthcare, the healthcare cost. So the controversy here is at what point is government not only providing services to kind of tackle these issues, but at the same time, how much of our responsibility are we supposed to also own of this issue? And I think this is a great balance that we need, because yes, there's lots of programs and services and insurance coverage and this and the other. But at some point, we also, I believe, as citizens, we have to, be responsible. And unless we don't want any help and we want to eat whatever and pay for everything. But you get my point here. There seems to be a kind of a balance that we also need to understand, because obviously when somebody, gets a chronic condition, they're going to be needing a lot of care, and that puts a big strain on healthcare as well.
I don't know how everyone else feels about it, but to be honest, I think there's not enough investment in preventative services.
Okay.
I feel that a lot of preventative programs that are out there, they are done by the efforts of that organization. For example, we're a nonprofit, so we seek grants, donations from the people who believe in the cause. So I think that when we can come together and collaborate and combine our efforts to really put that message out there of prevention is really important, and provide them with the tools, I think that's when people will see the impact in how much it's costing healthcare.
So that's the solution, right?
Hopefully.
Prevention.
That's an idea.
Obviously, prevention has to be the solution for everything.
I think we can learn
We
from
only
what
have a few seconds, huh?
what happened with smoking. Because smoking was the main reason for the major death mortality problems, and with the decrease in smoking, those reasons for dying, COPD has been going down in the last 10 years. So we can do something similar with obesity and obesity-related disorders.
But then, obviously, there's a big tax on
Sure.
cigarettes, and so.
That's why they wanted to do the tax on soda. There was this, initiative to tax soda.
So these are just signs that there's a lot going on to try to make us aware and to try to bring in a perspective of prevention, which I think that's going to have to be the key. We all have to learn a little bit more, like in your notes that you send me. There needs to be some understanding of how our body works and the food groups and then the relationship with chronic conditions. We all have to do our homework and then do our part. We run out of time. I want to really, really thank each one of you for making time. This is Saturday morning, and it's not easy sometimes to get up, and this is your free day in most instances. So thank you so much. And thank you for being with us today. This was AARP, Arizona Hispanic Connection. Have a great week.